Hello, my name is Mark Adahar, the doctor at Chicagoland's Men's Health. We probably met during your initial consultation, and if you're watching this video, likely that you've started testosterone therapy with us, which is great. I'm happy for you. You'll be convinced, like I was, that it's life-changing and nothing but great benefits when done appropriately. So this video today is to show you how to inject your testosterone. Okay, so you will receive a package at home from our pharmacy. Within that package, you will get a syringe like this with the needle attached. Okay, and then you will also get another needle without the syringe attached. This one will probably, yours will probably say 23 gauge on this needle. This one will be the syringe, and you might see that label where it says 21G times 1, okay? In order to inject your testosterone, Dr. Koff or myself will have already informed you what your dosage would have been. Usually it's 0.5, 0.75, or 1 ml. Okay, so first you take this, your syringe, and go ahead and open it up, as well as this one, and open this up and get everything ready, okay? I should say that it's important, please wash your hands before you inject your testosterone. Hand washing is very important to prevent any type of infections. You also need an alcohol pad and your vial of testosterone. Okay, so now if you look on this syringe, you will see numbers. 0.5, 1, 1.5, 2. So you're mainly going to be concentrating in this area right here between 1 and 0.1 and 0.5. Okay, so for this situation, let's say that you're injecting 1 ml, but it could range again from 0.5 to 1 ml in general. Okay, so you should crack open the plastic seal that's on top of your testosterone. Now, that is not this is not sterile, so it's very important that before every time you use your testosterone vial, that you wipe the top with the alcohol pad to keep everything sterile. Okay, so which is what I'm going to do now. I'm going to wipe the top with the alcohol pad. Okay. Next step is you're going to withdraw your testosterone. Okay, so as you see, this you take the syringe with the needle attached and you insert it into the middle. Okay, turn your vial upside down, and I am going to withdraw it to 1. Okay, now just to let you know, your testosterone, this is not testosterone, but it looks like it. I don't have my testosterone vial with me. Your testosterone will be clear, thick fluid. This one's actually a vitamin B12 shot. I'm using this as a demonstration because I don't have my testosterone with me. But your vial will look very similar to this. It will be colored, and it's about this size. But again, your fluid will be clear and not red colored like this one is, because this is vitamin B12. Now you have, I have 1 ml of the testosterone within this syringe. Again, your testosterone is going to be clear and it's going to be thick. You'll notice when you withdraw it, it's going to be very thick and very slow because it's oil-based. This was very quick because it was water-based. Following that, following that, you will take off this needle and attach the other needle. The reason why is because this needle is smaller and it will sting less when you put it, all right? Sting less when you inject it. Now, the next question is, where do you inject it? This testosterone should be an intramuscular injection. So obviously that means in the muscle. So your choices are, the preferred areas is the upper outer quadrant of the buttock on left and right sides. You can do the thigh at the most meaty part, or you can do the deltoid muscle itself. That one tends to be a little bit more, will cause a little bit more soreness. As you can see, this needle is a little bit long, unless you have a very well-developed deltoid. You don't want to hit your bone or anything like that, okay? If you were to do the thigh, let me bring this down. If we can. Okay, if you're gonna do a thigh, you know, you would bend your knee, and then you choose the middle part of the muscle with your knee bent, and you stick it right in, and then you inject. And I'm going to demonstrate for you the buttock because that's probably the most common place. So let me just adjust this a little bit so you guys can see my backside. Okay, so I'm about to inject,
Yes, we're gonna inject
the testosterone. Remember, again, one more time, your testosterone will be clear, not this color, because this is vitamin B12, it's not testosterone. So now I am going to inject the testosterone. Now we want you to put the upper outer portion. If you do it too much towards the middle, you can hit your sciatic nerve, which could be painful. So what I'm going to do is I'm going to put it right here on the upper outer part. All right, putting my pants down a little bit. You see my part of my booty. I'm going to clean this area up like this. Okay. What I'm going to do is I want to go perpendicular into the skin. 1, 2, 3, inject. Okay. And then I want to inject the full content in there. Now, because it's an oil base, it's going to be very slow to push. You're going to feel resistance, which is okay. But you want to put the plunger all the way down, okay? And then you should pull it right out. And there's no bleeding. You can see it's very rare that you'll have some bleeding. If you do have some bleeding, hold some pressure for about a minute, and that should take care of it. Okay, so that's how you inject your testosterone. The testosterone is usually injected at the beginning of the week. Don't forget the day after your testosterone to take your estrogen blocker, because testosterone can be converted to estrogen, so that's most commonly taken on the following day. We will be posting videos on how to inject the rest of the medications that you have been prescribed today. So I hope you enjoyed this video and check out our other videos. Great, have a great day.